Noting the hour and the presence of a quorum, I call this meeting to order. Please note that this meeting is being recorded by ActonTV, and if anyone in the room would like to record the meeting, you need to tell me about it. I see no one doing that, so we will move on to the first budget item, agenda item, which is citizens' concerns. I see no citizens with concerns. We will move on to the next budget item, which is a presentation from the Acton-Boxborough Regional School District of the current budget, the fiscal year 24 budget.
Good evening, everyone. I just want to note that I did bring a jacket too, but I was told to take it off. So I just want to make sure you understand. In all seriousness, first, thank you for having us. I think the purpose of our presentation tonight was really, just to talk about, some anomalies in the FY24 budget, the current year's operating budget. One specifically was a line item that we had found duplicated within the budget that caused us to have to revote the line item budget earlier this year, which was done with no change to the assessment to either community. And then the second one was just an increase in what we're seeing as special education costs that came after the voted budget. So I'm going to turn it over to Sherry Matthews. She is our new Director of Finance and Operations for the school district, and we're very pleased to welcome her and put her right through the gauntlet right away.
Good evening. Jason, if you can go to the next slide. So as Peter just said, we found a $425,000 mishap that we have a line item in the budget called vacancy factor. It's a negative $425,000 line. And when we were reviewing the budget, it was after the beginning of the fiscal year, we found that the vacancy factor was erroneously double counted in a way that was identified, like when we figured out the budget preparation process. So we proposed to close the budget. We presented at a school committee meeting, and we proposed to close the budget gap by a combination of reducing the personnel expenses and using additional unanticipated revenue included in the final state budget. If you go to the next screen, I can kind of break it down for you. So what you see here is what we estimated the revenue to be and what the budget was. So the total budget that was approved this spring was the $105,897,586. And the way that we proposed to eliminate the $425,000 gap is we had a savings through attrition. There was a position that we weren't going to replace, which would have saved us $98,173. And then we did have an increase in our Chapter 70 funding of $150,420. And we had an increase in our transportation aid. So by using those numbers, we were able to unaffect the assessment, but we needed to have a school committee vote to change the budget to $106,224,413. And if you go to the next page, you can see that nothing was changed in the assessment. We have the previous voted of the 105 and the revised budget of the 106. And we just changed our revenues, and it did not change anything from the Acton or the Boxborough assessment. But what it does mean is, if I'm saying this correctly, that revenue will not be able to be used for next year. We're offsetting the revenue, right, for this year?
Yeah, correct. So, typically, once we vote a budget, any revenue changes that come in after that budget just go toward our turnback at the end of the year on the revenue side. And so obviously this move decreases the amount of revenue turnback we would expect by the tune of about $300,000, $325,000.
Yep. And then if you go to the last page, I can kind of break down. These were some unanticipated special education costs we had. We had 10 move-ins, and this would be after the budget was voted in the spring. We had more qualifying students for placements. We had rising kindergarten needs. We did have a new assistant director that was hired, and then we had 2 additional outplaced students, one for September and one we found out in August. So the personnel costs were the one assistant director, we had to hire 2 teachers, an ABA tutor, and 6.5 assistants for all the new needs we had. And that was $571,613. And then the 2 out-of-district costs combined were $277,970. So it was an additional $800 and almost $50,000 that was unanticipated since the budget was approved in May. That kind of puts into perspective where we stand right now. Does anyone have any questions?
Can I make a couple of comments here?
Sure.
You know, one, just to go back to the first topic, which was the $425,000 that we found, which had been just placed into 2 line items. One line item very specifically called out in the budget, the negative $425,000. The challenge we found was that that number also got put into a spreadsheet that fed multiple lines into another line item, so it wasn't an equal amount that you could see in the budget. So that's why it took a little bit of time to uncover where that was. And we understand what the issue is. We've taken a number of steps. I think you have a memo from us with some different action steps that we've taken to rectify that and make sure it doesn't happen again. We also, just want to recognize that we also know that by increasing the overall budget, we know that that increases the base that we're going to have to contend with as a school district going into the, next fiscal year as well. So that's something that's on our minds. In terms of special education costs, it certainly isn't uncommon for districts to incur additional special education costs in a fiscal year once it's already started. One of the reserve accounts that the district holds is called a circuit breaker reserve. You've probably heard that mentioned at previous budget presentations. That is intended to help fund unanticipated out-of-district costs. And so districts, when we have new costs that come up during the school year, what we typically do is increase the amount of the special education tuitions to out-of-district schools that get charged to that circuit breaker account so that we're not increasing the overall budget within a fiscal year. And then, as we always have to in special education, every single year we have to reevaluate the required services in order to determine what we're going to have to carry forward into the next year. I think, just to understand a little bit of process, whenever we have either a student that moves in who's new to us after the budget process, or we have a student whose IEP process started after the adoption of the budget, we actually go through a process where we analyze all of the required minutes that come out of an IEP. And so, for example, in a student's individualized educational plan, you might have something that says they need 90 minutes per week of required reading services, for specialized reading services. Once that's in an IEP, the district is mandated to provide that service. It's a legal requirement. And so what we do is we actually look at, could that student be grouped with other students in order to get the required number of services? Are there staff that might have available time anywhere in the district who could also provide those services? And once we've gone through that whole decision-making matrix of what resources we have inside the district, if we don't have available staff to provide the required minutes, we have to go make sure that we hire the staff that can. So just to make sure you understand, when we say these are additional special ed costs, these are things that we're required by law to provide. And so we have to make sure that we do that, and that's where you see the increase. In terms of out-of-district costs, I would say, 277 is probably just slightly above the mean out-of-district cost that the district would pay. It's not that's, just barely above that kind of middle ground, but what we're talking about. And sometimes out-of-district costs can also include additional one-to-one services, depending on a student's IEP needs. So I just wanted to lend a little bit of color to that explanation. And then, as Sherry said, happy to take questions.
Thank you. Does anyone have any questions? Steve?
Sure. So this is all sped costs, unanticipated sped?
The one that we had planned for was the assistant director position. One of the things we've done over the last, probably 8 years is we've built out, a good number of special education programs that have actually allowed students to stay in district where we would have previously placed them out. There's efficiencies involved in that, and so even though we've added staff to support them in district, it's a lot less money than what we would have paid to have them out. So the assistant director was really supporting a lot of those programs directly. We knew about that at the end of the year last year. The school committee voted to fund that through the use of this, this year's circuit breaker reserve. All the other positions were definitely unanticipated, came up after the budget process.
And what does rising kindergarten needs mean?
We had students coming into kindergarten who had very high degrees of specialized needs required in an IEP.
What percentage of kids are on an IED in the system these days?
About between 15 and 16%, give or take something.
It's close enough.
Anyone else? So there's the 850,000 ballpark. Are you saying that's covered by circuit breaker, or is this also, because you have the bottom line budget, I know the money needs to come.
Correct, yeah, the bottom line budget is still the bottom line budget. All we've done, because these are personnel costs, we pay for the personnel costs inside the budget, but we take other budgeted money that would have been set aside for out-of-district costs and shift that into circuit breaker.
Okay.
So yes, this is all circuit breaker. It's from a reserve account, not from increasing the bottom line budget.
Yeah, so this is not coming out of turnbacks.
Correct. Right, yep, correct. Just wanted to make sure.
Yeah, thank you. So what I'm hearing is that you know how the problem happened. It's not something we could have caught with a closer looking at the budget.
I think if we could do anything different, I think, it's possible that we hold additional out-of-district placements in the budget, and we traditionally do that, and we did going into this year. I think one of the challenges we're seeing as we're trying to continually reduce the budget over the last few years, we're budgeting very, very close to actual at this point, and we've kind of reduced any places where we knew that we had some flexibility, and so in prior years, if we ever had an overage in a line or a new, staff member that had to come in because of a required service, we always could kind of count on some room within the budget to be able to cover that, and that's gone. And I think, I would foresee that turnbacks are going to be minimal on the expense side of the budget this year. We're so close to actual. We will have some additional revenue. We know interest income is actually up, things like that. But, the expense side's so tight now that, yeah, it's all reserve money.
Okay. Go ahead, Steve.
Yeah, I just point out that not so much in the past few years, but over the long term, this was always the biggest wild card in the school budget because you could never really accurately predict it. Especially when we do budgets like a year in advance of enrollment. So sorry to see it's come back, but if you go back in history, you'll find bigger problems.
And what I'm hearing is the double counting problem was maybe complicated to find, but all taken care of and not going to crop up again.
Yeah, I think the idea of the vacancy factor historically was there was a period of time when the district had very large turnbacks. And I think there were a lot of questions about why the district could turn back so much money on personnel every year. And so they started kind of baking into the budget this negative amount that would reduce the amount of turnbacks at the end of the year and make the budget kind of trend closer to actual. I think in our ideal world, looking forward, we'd love to get rid of that negative amount, but to get rid of two negative $425,000 numbers is just not realistic in this environment. So I think over time, we're going to want to try and reduce that a little bit.
Thank you. Thank you very much. I think that's it. Appreciate you coming. Thank you. Thank you. All right, next item up is our very own Steve Noon presenting on the health of the Health Insurance Trust.
You people look a lot more intimidating from this angle. Thank you for inviting me. No. And that's about the only humor you're going to find in this presentation. So let me start by giving a brief overview of what the Health Insurance Trust is, what it does. So the objective is simply to provide a good health care package cost effectively for the employees. And we cover about 302 individuals, 535 families, and 600 retirees. Board of Trustees is made up of Melissa Andrew, who's the school district treasurer, Andrew Schwartz from the school committee, Teresa O'Leary, who's the Acton tax collector and assistant treasurer, Alyssa Nicole from the select board, and me from the finance committee. I am by default chair. I am the longest serving trustee. So what does it do? So the Health Insurance Trust is actually a self-insurance organization. We contract with carriers like Blue Cross and Harvard Pilgrim and Tufts to administer programs for us. So the employees or the users of our system deal with them as though they are any other subscriber, but in fact, the risk is not borne by Blue Cross or Harvard Pilgrim, it's borne by the trust. We pay them for their administration, services. So the trust actually selects rates, collects the contributions from the town, the schools, and the employees, and pays the claims. Now, we do not design the plans. We do not dictate co-pays, deductibles, any of that. So to protect ourselves from very large claims, we buy a reinsurance package or stop loss every year that essentially says for a premium, we will pay up to $175,000 of an individual claim, and any amount after that is paid by the reinsurance company. And we have an independent treasurer, a consultant who advises on rates and things like that, and we have an annual audit conducted by an independent CPA. So looking at revenues last year, we had contributions from the town, the school district, and employees, 14.7 million. Employee contributions was 4.5, retiree contributions was 1.2. Part of the 14.7 was our end of the retirees. We pay 50% of retirees' costs, and we pay 75% of active employees' insurance. So anyway, our revenue came to $20.4 million for the year. Our expenses, however, came in at 22.1. Claims were 20.1 million. Our administrative costs, paying Blue Cross, Harvard Pilgrim, the consulting, some of the admin costs in our treasury, come to another $1 million. And the biggest problem was last year we paid a premium for reinsurance of approximately 1.3 million. And we recovered only 300,000 on major claims. So we lost $1 million on reinsurance. So in effect, that ruined the year. Otherwise, we were on track to, I wouldn't say we were going to break even, but we were looking fairly good through the first half of the year, and then claims started to pile up, and sadly, very few of them ever reached the reimbursement point from the reinsurance. Second half of the year, claims really started to climb. And so came down to it last year, we lost 1.6 million and, against a 10% increase in rates, which was one of the highest ones we'd ever. 23. So, in 4 lines, the top 2 are revenues and expenses. You can see over the years, they kind of crisscross back and forth, but of late, the kind of orangey line, expenses has been regularly outproducing the revenue line. The yellow line was the ending fund balance, basically our reserves. And the kind of gray line was the net profit loss. So we peaked with reserves of about $8 million back in FY18. At the time, we considered that to be somewhat excessive. Guideline is we should maintain about 10, maybe 20% in reserves. That was at the time closer to 45% of the reserves. So we had a couple of years when one we did 0 increase, and one we did like 4, essentially trying to burn off some of the reserves and get them back down. Our timing was excellent because as soon as we accomplished the burning off of reserves, COVID hit. And we've been struggling to get the trust back on a profitable basis since. Next slide, I'll just talk a little bit about the challenges of being a trustee. This is the year-over-year change in revenue and expenses. The blue line are expenses and the kind of orangey line is revenue. As you can see, they seldom move together, and the revenue tends to lag behind the expenses, basically. Once we incur higher expenses in a year, we adjust for it with the rates of the next year. I know it's just percentages, but the funny thing is, I think the only year on the chart where we actually got it right was FY23, but we still lost money. Next slide. So here's the sad story of our reinsurance. The premium line is in blue. You can see it reached almost up to 1.4 million last year. The recovery line is in orange, and with the exception of FY21, which is a real good year for reinsurance recoveries, we've been behind every other year since FY18. This year being the biggest single loss we've ever recorded on reinsurance. Next slide, please. So if you remember, I pointed out the almost $8+ million reserve or ending balance in FY18. So this is a question of where did it go? Again, as I said, we had a couple of years of artificially low rates that took off about 1.2 billion of our reserves. We have a claim that started in 2015. In the terminology, it's called a laser. Laser is essentially a reinsurance claim that you don't get reimbursed at the agreed upon limit. You have a much higher limit because it's an existing claim that's going to run into big money every year. Our laser's set at $730,000 a year, and the claim has hit that just about perfectly every year, meaning we pay it, we don't get any reimbursement. You know, it's a known issue, and they do it this way, they could charge us $2 million for reinsurance and pay the claim themselves. But, you know, the way reinsurance works is if they can identify significant claims, then they exclude that from your package. So that one is taken care of 3.7 million of our reserves over the years. The total of what I showed otherwise in the stop loss is accounted for $1.3 million of lost reserves, most of that occurring this year. And what we call the COVID bounce, which was 1 year people didn't use medical services much, and then next year it went through the roof. And that was another 1.2 million over the time period. So again, that answers the question, where did our reserves go? So now we're down to precious little in reserves. So our reserves have fallen below acceptable levels. As of the end of the year, they were less than $500,000. Rate increases equivalent to 10% annually are not covering our cost increases. We've seen a rapid increase in the first 2 months of this year. It's even worse than the last month of last year. So for the months of June, July, and August, our claims are actually running 50% higher than the same months in FY23 or FY22. Now, the deficits for 2 months have totaled already 1.5 million. It's unprecedented levels of claims. The silver lining is that we have identified at least $500,000 is coming back now from stop loss insurance. So we have reason to believe that some of this is just some very large claims that are hitting us all at once, and we will recover much of it as the year goes on. Some of it is still a carryover from Hewlett. I've been looking at printers all day, Hewlett. Harvard Pilgrim's data breach that occurred back in March. And for a while, nothing went through their system. And since they came back, we seem to be playing catch up with claims that should have happened last year. I can't believe last year would have been worse than it already was. But we keep getting more claims on their plans than would normally be expected. Now, another silver lining is last year we negotiated a rebate program with Blue Cross on some pharmaceutical products, which will start it started with the beginning of the year, but we won't see the revenue from it till the second quarter because it lags a quarter. And that could produce about $400,000 in savings annually and $300,000 for the first year. We went to a new pricing model for pharmacy products with Blue Cross. So what do we know and what don't we know? We know our claims are increasing at alarming rates. We also know that we won't be as bad on stop loss as we were last year because we've already recovered more last year, in this 2 months than we did in the entire of last year. We also know our rates aren't too low. We've compared our rates to the state's Group Insurance Commission and the West Suburban Health Group, which includes places like Wellesley, Dover, Holliston, Brentham, Dover, Sherburne Regional, Wayland Natick, and I'll go into that a little bit more detail in a couple of slides. So we don't believe our rates are out of line, but we do have to recognize the fact that we have just unprecedented levels of claims coming in the last few months. What we don't know is whether this is a significant number of very large claims hitting us, and then we would get reimbursed after $175,000, or are we looking at just a very large increase in utilization by a broad number of our subscribers? We know that, we don't have information about this, the state's program. We do have information on the West Suburban plan because we have the same consultants, and, they are not seeing the same level of claims that we are. So we have every reason to believe it's a bunch of large dollar claims, but we can't prove that right now. The data's not there. So this is what I mean graphically. This is the month-by-month claims going back to July 2020. And you can see they bump along. Claims is the gray line, and the contributions to the trust, the yellow line. So there's always month-to-month variation in claims. Part of it is the claims processing by Blue Cross and Harvard Pilgrim both have a series of 4-week months and 5-week months. So there's just a natural fluctuation until you get to the very end when the line just starts going up. And at this point, we don't know where it's going to end. Next slide. So this is just a quick comparison. The first two columns are a couple of our plans, Network Blue with Blue Cross and HP HMO. Bottom's cut off, but what's comparable on the next three, West Suburban Health Group is the first two columns, and the state group insurance is the last column. So our rates as far as the group insurance goes, the comparable plans there are Harvard Pilgrim plans, and we're actually a little higher. We're 5% higher on individual and 3% higher on families than what the state's planning. As far as the Network Blue goes, our individual rates compared to the West Suburban Health Group we're higher than them by 5% on individuals, and on families we're lower by 5%. So we're all in the same general ballpark on what we're charging our subscribers for the comparable plans. There are many more plans offered by each, but these were the ones that were most comparable in plan design. So we can't say it positively. Again, the evidence we have is it's not rates. We're not undercharging for the plans we're providing. So what we've done, December last year, we increased the rates by 8%, and we knew we were getting the savings from the pharmaceutical change. So that was going to total about $1.6 million from the rate and $400,000 on the savings. So that was going to be a $2 million increase, effectively another 10% change. In June of this year, we renewed our stop loss, but we held the premium level by competitive bidding with last year. So it did not increase in cost as it had in many of the prior years. We reduced some administrative fees with Harvard Pilgrim and some trust expenses by about 18%. We hired a new consultant, and they have been working very diligently to develop data and recommendations for us to look at in terms of options for solving the problem. Last week, we adopted a new model for retiree coverage, which will save the trust $233,000 and save the retirees the same amount. And we have developed a series of cost-saving options. So, these are not additive. Trust has authority to do some things, not everything. We can raise rates. If we only raise rates, we're going to have to look at a 15% increase in rates for next year, minimal. We can reduce costs. Plan design, which is essentially copays and deductibles and things like that, has the potential to save about $1.4 million. But it is something that the town and the schools will have to collectively bargain with the unions on. Changing the cost share, right now we're a 75-25. If you went to a 70-30, it would save about $900,000, but again, is a collective bargain situation. The of the two, plan design has benefits to both parties. Everybody's cost goes down a bit. Cost share is a straight, the employer wins, the employees lose equally. So it's on the list because it's something that can be done. As far as the trust goes, Medicare migration could save us about $500,000. There are relatively few, but there are some employees who do not actually qualify for Medicare. I think they have to go back many years, but they never got enough quarters into the system to qualify. So when an employee gets to 65, they have to go onto Medicare according to Chapter 32, I think it is, of the state law, which we adopted years ago. You can buy people into Medicare that didn't have the coverage. There's penalties involved, but you can't do it. Our consultants think this might be worth doing, and they've identified at least one person who is in our major claim category. So it could work out that we could save as much as $500,000 if we move pay the penalties and move the people over onto Medicare's books as opposed to ours. Pharmacy benefit management is something the trust can also do. Could save $1 million or so. What this is separating the prescription coverage from the medical coverage. Right now, you probably are all familiar with pharmacy benefit management, whether you realize it or not. Pharmacy benefit managers are people like CVS Caremark, Express Scripts, people like that. And in fact, the Blue Cross, I believe, is using CVS Caremark now instead of Express Scripts. They're doing it already, the Blue Crosses and the Harvard Pilgrims. The benefits of pharmacy benefit management are meant to go to the insurers. We're the insurer in this what ways we got Blue Cross to concede money last year was more or less just mentioning the words to them that we might go this way. I think there's more money to be had, and I think we're going to have to pursue that option as far as we can. The other possibility is third-party administration as opposed to using Blue Cross and Harvard Pilgrim to do the administration. We have reason to believe it could be less expensive by $300,000. So, as far as next steps go, Trust is pursuing all the options currently under our authority. Like I said, we just dealt with the retiree coverage. We're looking into the Medicare migration, the pharmacy benefit management, third-party administration. But plan design and cost sharing are not within our authority to do. And I believe they were last changed 7 years ago. And Mary Ann, you probably remember better than I, but it was a process of the town, the schools sitting down jointly with representatives of all the unions, and basically acted as a coalition and bargained changes in the plan design and cost share. At that time, I believe we were 80-20. As far as timing goes, that's not something that's going to happen this year. Pharmacy benefit management probably isn't something that can get done this year. By this year, I mean by June 30. Whatever we do not do in terms of cost savings programs will need to be made up by rate increases next year. So, and by next year, I mean the budget we're talking about now. Which is why I'm coming here tonight, and while I'll be talking to the school committee on the 19th, I think, and the Board of Selectmen soon. Questions?
Roland.
So you're offering a HMO, a PPO, and a high deductible. Is there any consideration to get rid of the HMO and just go with the PPO and the high deductible? My company recently did that, and we have a lot more employees than the town obviously does, but it's a way that they're saving costs. And I don't know if that would be something that could be on the table. You know, you're still offering health care, but you're just offering it in a slightly different package than the HMO. And you're kind of then simplifying administration, but you're only administering 2 plans versus 3.
HMOs are becoming less and less popular every year from what I can see. We still have them. We still have people signing up for them. We're not at the stage where we would think about reductions of the type of plans we offer. We run them basically a profit and loss in every plan, every month anyway. They're not my worst problem at the moment. And we can rate them differently in terms of contributions. We would look at the profitability probably in a couple months to see if there are plans that we think aren't going to make the cut.
Yeah, the other one might be considered is maybe getting rid of Harvard Pilgrim, going with Tufts or another HMO that, I don't know if that would save anything, but I know from my own family's experience, HPHC has been very difficult to deal with lately.
The problem is now they're both something called .32 health. Harvard Pilgrim and Tufts have merged. And I think they're both owned by CVS at this point. It's rapidly becoming, there's only a couple healthcare companies in the country. So, yeah. In fact, when we had our, presentations on the retiree packages last week, and they presented jointly. There was a team, one person from Harvard Pilgrim and two from Tufts, because in the past we'd had both of them on our retiree program, and they only came in and pitched one plan. So, yeah, stay tuned. You'll probably only see a few plans coming from them.
Dave?
So who handles the claims adjudication now?
In terms of, yeah, if you're in a Blue Cross administered plan, Blue Cross does it. If you're in a Harvard Pilgrim administered plan, they do it. We don't get, I can remember maybe one or two issues rising to the level of the trust, but in the 5 years I've been involved, so yeah, it's handled at that level.
So, but it sounds like now, right now, you don't have visibility into what the cost is of the rise, or what's inside of the claims that's causing the rise in cost?
There are a couple of issues. First is HIPAA. Second is the lag in reporting time. It's a bit like driving the truck with your windshield blocked and you only have your rear view mirror. And you wonder why you keep bumping into things. You know, I don't have any data on September yet. And the year-end numbers were really slow coming. What we get is our consultants have the ability to look at it and give us, analysis. They were the ones that told us how many claims we had that were approaching the stop-loss limit last year. Unfortunately, as the year ended, we had about 12 or 13 claims that had only reached half of the stop-loss limit. So they never got to the point of being reimbursed. Yeah, it's not, I don't get a lot of data to look at, and you can imagine how frustrating that gets me. I get reports. I get better reports with this consultant than we got with the previous one. So we're hopeful we'll learn more as we go, but mostly I look at a lot of history. And as I said, the level of claims in the last few months is unprecedented by anything we've seen in the past.
So the new consultant, though, probably should have a much bigger data set to look in, and they're agreeing that the past one also saw the spike in claim cost?
I'm not going to blame the new consultant, because there was only 1 month of the spike with the old consultant, and the new one started July 1st. They probably are sorry they ever bid on the job at this point, but they're working pretty hard. They've offered probably more ideas in 2 months than we got from the other one in the prior 2 years. So we feel we made the right decision there.
Yeah, and one thought is my understanding is the insurers themselves, they get obviously millions of claims, and they can subscribe to services that are like, really powerful analytics. They understand, they can compare claims across geographies and, similar codes and all this stuff. And then they can literally make adjustments to those claims, and they can push the new claim back to the provider saying, you said it was 800, it's actually 550 because you're in network and this is the correct code or whatever it is. And in many cases, those are just accepted. And I'm not trying not to read between the lines, but it sounds like with the spike in cost and claims, that there may be something very unusual going on that needs just obviously deeper understanding, which you don't have, but maybe the consultant or the insurers has.
We haven't changed anything in terms of administrative services on claims yet,
Yeah.
so it's still the same organization processing the claims. The deep analytical stuff, I think I get like once a year from them. I get better information now from the consultants we have, but I'm not seeing the kind of information that you could use to prospectively change what you're doing, or I'm reacting to what happened. Claims being paid when they hit our stuff happened a long time ago.
So the insurer pays, and just essentially gets whatever bill they get, they pay, and then they bill the health insurance trust.
Yeah. So they pay slowly to begin with.
Yeah, sure.
And then they bill us for the claim. So I'm looking at stuff that probably happened 6 months ago.
I guess I'm wondering if the consultant through the insurer, can just request what services could offer be for claims adjustment.
One of the things we're going to do is we're going to put out the whole administration thing for bid and
Yeah.
see what we can get in terms of better information, from maybe a third party, or maybe it will spur on these guys to step up their game.
Jason, did you have one?
Two question. Actually, you were just mentioning that it takes a while to get billed and for the claim to come through. So, is it possible that with the Harvard Pilgrim breach, that some of the claims haven't come in yet and they would have been eligible for last year's circuit breaker?
It's possible.
And will we still get reimbursed even though we've traversed fiscal years?
It's a 12-year contract, but a 24-month run out. So if the claims come in that should have been processed last year, it put them over the top, we'd get reimbursed.
Okay, so as long as Harvard Pilgrim gets their house in order within the next 12 months and processes all the claims from the last year, we're all set.
Yeah.
And same with the recap, we'll be covered. Okay, that's reassuring. Does the pharmacy benefit management, if we make a change there, does that hurt the subscribers? Because you said it's basically there to help the insurers, but what's on the other side?
Well, so the way it's working right now, there's basically 3 pharmacy benefit manager type companies out there: CVS, Caremark, Express Scripts, and Optum. Essentially, like I said, Blue Cross uses CVS, Caremark at this time. Last year at this time, they were using Express Scripts. They're doing it already, but we're the insurer. We could cut our own deal with one of the 3. And the way the cash flow works is the subscriber doesn't see the difference. There's rebates that flow back and forth between the pharmacy benefit manager, the manufacturer of the pharmaceutical, and the insurer. We suspect we're not getting all the rebates we could be getting if we were on our own.
Well, it seems like one of the easier things to do if it doesn't have an impact on the subscriber.
We're trying to do almost nothing that has an impact on the subscriber, but we need to act quickly, we need to act significantly, but we have to be a little careful about messing up people's health care.
Then my last question, you were also just mentioning that you were thinking of putting the management out to third party, the administration out to third party bid. So are you suggesting we could potentially end up with, I realize you said there's getting to be a fewer and fewer number of companies that do this, but is there a risk of getting, some no-name Joe's Insurance Company?
No. The consultants we use would put it out to bid. They would vet the bidders. We just went through it with the retiree plan. And they'd all be reputable outfits. There's a lot of people out there that do it. The Blue Cross admin costs have already been a little higher than the Harvard Pilgrim, and we have sometimes brought them down by telling them we're going to put it all over the Harvard Pilgrim. But it's also a big change to the subscribers in the way they perceive the system working. So, and it's one of the smaller amounts of cost savings on the grid. Like I said, anything we can get by cost savings, we will try and get by cost savings, because the alternative is you just raise the rates more.
Thank you.
I'm happy to talk to you further about my experience with any of this. My insurance company recently, I have the same company, the same network underneath. They must have renegotiated with a bunch of the providers, because people who used to be in network aren't anymore. The expenses for care have gone up. I have a high deductible plan, so I've always known what the numbers were, and there was a significant increase in the last year. I do have a pharmacy benefit manager, and I'm saving a ton of money. It is much cheaper to go through them than it was to go through my same insurance. So it's one of those, we save money on both ends. Our insurer also has I don't know how this works, they have an administration company that they're associated with, and somehow it's cheaper to work through them. They ensure that I only see in-network options. The company lost money on their health insurance trust last year, a big number, and didn't raise rates this year because of these other savings
Yeah, no,
they were able to make.
there's a lot out there.
Yeah, so, but I suspect what you're describing, in spite of it not having happened to the other companies your consultant knows about, is maybe not as uncommon. So it sounds like we don't have any idea what's driving the claims up.
It will become clear in a month or two, but I didn't feel like I could wait a month to talk about it. So, as far as, if I had to guess, I'd say it's a lot of large claims, because we were seeing that trend the end of last year, and it seems to be continuing, and we can't find other places that are experienced, If it was a demographic change and everybody was going to the doctor more, other groups would see it. And
Oh, I'm
they're
sorry.
not.
The other thing I wanted to say about the administration company that we have now, the claims are going through more or less immediately. Because I check, we've got enough going on. I check on the website what my current claim status is, and the longest delay I've seen before a claim hits the insurer, shows up for me with my EOB, has been 3 weeks. So it's possible that you could find, like I said, this is a branch of my insurance company, so none of the underlying insurance I have, I still have my doctors, et cetera. I know how the plan works. It's the same deductible and all those things. It's just that somehow it's more efficient. Doesn't make sense to me how they can do it from a business angle, but, so there might be some good options for you out there, because I know people will spend more money to go see their doctor and to go to their hospital, and that's one of those things that can drive up a bunch of costs, usage-wise.
Yeah. The networks are pretty much merged. There's a lot of overlap, especially when you get to Medicare. It's like just about every doctor will take it. So when we were looking through retirees, there was almost no disruption that we could think of.
I don't recommend my insurance then. I'm finding out many people make it.
But part of plan design is limited networks. You know, and that's where, yes, somebody can save some money, not always a subscriber.
Adam?
Yeah, what total percentage of the annual budget is your reinsurance premiums?
Last year it was, let's say, you can do the math, 1.3 million in premiums against a total budget of 21 million, so.
So less than one, is that less than 1%? Yeah. Okay. And then would you say overall in the long term that the reinsurance has at least broken even, or has it always been a loss?
I can't go back, I can go back further than the slide I had, but I'd say it has more often than not been a loss,
And what are the?
but not, you know, a close, you know, not the kind of divergence between premium and recovery we saw this past year. And the cost of reinsurance has gone up a lot over the past 5 years. But, well, Dave, you're in the insurance business. You'd be surprised if we always made money on reinsurance. Yeah, that's not the way they do calculate the rate. But generally, in the past, I would say, if we were paying $1 million or $1.1 million in premiums, I would expect $700,000 to $800,000 at least in recoveries that year. I wouldn't necessarily expect we're going to, you know, get it all back because the service they're providing is keeping us from being hit with a catastrophic risk.
Right.
That's worth something. But I'd never seen, you know, one go this bad.
Yeah, I mean, the curiosity to me would be if it's over the long term always a loser, you know, how does that conversation go at the negotiation table when you sit down with the reinsurer and say, look, we've been doing this for 10 years and we've been losing money on you. You've been making money on us.
Well, your experience is going to affect your rate. So if they lose money, you know, it's going to go up the next year. One of the things we are considering doing is the new consultant actually has access to a larger pool, and we're trying to see whether it would make sense next year to go in with their pool as opposed to only our, you know, experience. This past year, we have very good experiences. The one going on, we may not, from their point of view. So there's a lot of balls up in the air, but at the moment, every time I look at a report, I just cringe. Either I've lost money on reinsurance or my claims seem out of control.
Yeah, does the reinsurance have the ability to sort of pre-exclude certain claim types, or?
Well,
I know that they exclude pre-existing claims, but can they also say, oh, and we also don't cover this type of claim or this type of claim or this type of claim?
what they have the ability to do is quote with another laser, meaning they look at your claims history, and everybody that quoted, and we got multiple quotes this past year, quoted the same $730,000 laser or exclusion. One of them actually quoted another one for about $400,000. We didn't go with them. In the past, we've had multiple lasers going on at the same time. So the way they do it is they look and see what's going on with significant claims, and to the extent they want to exclude that from their bid, they do. It often makes them uncompetitive. But if you get one like we've had, the 730,000 one for the last 5 years or so, everybody bids it the same. So you don't have a choice of, I'll take the one that didn't exclude that claim. They all do it.
Thank you.
Jason?
I have a follow-up question. On this stop-loss insurance, so obviously the blue line is fixed. That was what was negotiated and set. Since there is another 12-month, or at this point, another 9-month run out, is it possible for that orange line to move north? Is it possible that some of these claims that are coming in late from Harvard Pilgrim will qualify for stop-loss, or are we far enough in that everything's caught up?
No, there's, that's as of June 30. So, yeah, it could move slightly up or, depends on, I think not sure how our accountant's gonna, they do an adjustment on the financial statements for things that happened afterwards. I'm telling you, this is based on my cash flow for the year. When they get through adjusting for timing differences, it may look a little different.
So,
It can only look better, I will say that.
right, so to Adam's point, the yawning chasm between these two lines could get better, but probably not significantly so, is what you're saying.
I don't think so.
Okay.
Christine, did you want to? Okay, Adam?
Yes, I'm just back of the envelope calculation. It looks like the premiums have gone up about 17% per year for the last 5 years?
Yeah.
Okay. And
This year, we'll get a level premium, so.
the gap, to me, the gap between the recovery and the premium isn't shocking because your upside loss of not paying that premium is just about unlimited, isn't it?
Yes.
I mean, I'm sure there's some calculable amount, but it could be anything.
You're never going to not have stop-loss insurance.
Yeah.
If you go that route, then we might as well just go back to a fully insured program. I mean, the reason you go to a self-insured program is to eliminate the middleman's profit. And you protect yourself from the catastrophe by buying the insurance. So you're never not going to do it. You can raise the 175 to something bigger if you want to take more risk. And we have done that at times to keep the premium down, but it's still a matter of, if we didn't have it and we had a couple more like that $730,000 annual claim, and out of a population as big as we have, roughly 1,000 lives, you can get more than one major claim going pretty easily. So
just one more follow-up question to that point specifically, which would be, did we not have stop-loss insurance in place when that claim started that would cover that claim, or how is that claim avoiding reinsurance?
It worked the first year, not any year afterwards. Once it was on the books, then.
So if we were to get hit with some big catastrophic claim, the reinsurance would only cover it for the first year, and after that, it's on us?
No, they establish what they're willing to pay. If it goes over 730,000, they pay it.
I see.
They're excluding, it's like, in this one case only, where you're gonna have a much higher deductible than all your other patients.
Thank you. I didn't understand that the first time you explained it. Now I get it. So instead of the 175, that particular claim is 7 and change.
Quite all right. I spent my first year as a trustee going, what the hell is a laser?
Thank
What's
you.
that got to do with what we're talking about?
Thank you, Steve.
Thank you.
Okay, next item on the agenda is the Water District PFAS costs. I'm hoping you all had a chance to review the basic cost information from the Water District and come up with some questions. They've invited us to attend their October 23rd or November 6th meeting. We could be the very first item. They've given us 15 minutes in which we can ask questions or send questions ahead of time, and they will address our issues. They'll speak to our questions regarding what potential costs are around PFAS mitigation. They already have 2 0% loans from the state. I personally would like to know how that plays out to the ratepayers and the structure of that, whether it's a per household charge or if it's baked into the rate per gallon. They didn't indicate the term of the loans or any of that other information. I'm saying this in part because I'm not sure how many of you got a chance to look at it recently to refresh your memories. Any questions, thoughts from anyone specifically? Adam?
I like the idea of we could just send our questions to you and you could collate them and send them along in advance.
Certainly. Dave?
You know, I have a couple questions that I could just pass along to you, but I'll start with more of a philosophical view on this issue. So the state passes regulation in 2020, you know, with pretty stringent PFAS levels. And the amount of money that they have allocated for those 0% interest loans is about $15 million, and possibly to start, right? So it's the 8.7, 5.4, and $1+ million or whatever. So I would suggest just generically that most communities in this state and this country can't afford to mitigate PFAS in their water systems. It's such a gigantic number that clearly you need state or federal support to do that. I'll just speak for Acton, is $15 million is a sizable number. We do finance and take out loans and bonds for these sorts of projects, of course. There's probably 90% of the state, 80%, that's a big number, and there's a million other pressing things, but they're, through the state regulation, required to adhere to those standards. So how do they finance it? How will almost anybody finance this cost across the country? And I'm not saying it's not something that should be mitigated, it's just, it's an extremely expensive problem. And one that the federal government is stepping up with some money in public water, drinking funds, et cetera. So if you look at the EPA website, and just forgive me, I'll just throw a couple numbers out there really quickly, just for some context. But the EPA says they expect, so the EPA put out a proposed rule this March. It's not a final rule, but a proposed rule with much lower standards in the state of Massachusetts, as far as I understand it. I'm not an expert in any of this. But it says the EPA expects roughly 66,000 water systems will be subject to the rule, with approximately 3,400 to 6,300 systems anticipated to exceed one or more of the minimum content levels. So let's just say 5,000 systems. And then they put out some numbers, but their numbers roughly are essentially, at least according to my math, $160,000 a year to capital and operate one of these systems, assuming there's 5,000, given the numbers that they've thrown out there. My math could be way wrong, but $15 million is a big number. And if, I'm not saying it shouldn't be spent at all, I'm just saying is there needs to be a lot of state and federal funding for these sorts of projects for, I think, the country and the state to adhere to any of these standards, because it's not anything. And if you want to talk about like equity, like you could have a lot of towns that do invest in the best filters and have the best drinking water, and 70% of the Commonwealth is like, no, we're drinking PFAS infected water. So I just throw that out there because the EPA website, I'm just throwing some rough numbers out there, but the annual costs are, you know, a fraction of what we're talking about, even if these are 0% interest loans. And to your point, I mean, if you're talking about $15 million, the average term of a new water district bond is about 20 years typically. So that's $1.5 million a year with the operating cost at $500,000 to $750,000. Like that's a big number. I don't know how many households there are in town, but I mean, $1.5 million divided by whatever the number is, it's a sizable increase at 0% interest. So I'm not saying anything against PFAS. I'm just saying there needs to be a more holistic way of individual towns a long-winded way of saying, is it worth waiting to see what other support there is from other alternative funding sources for an option like this?
My understanding is that we don't have the option of waiting, that the state requires us to wait. As you said, the EPA ruling has not been finalized. That's, the EPA ruling is for different PFAS. There's only some overlap between the
Sure.
Massachusetts PFAS and the EPA PFAS. EPA is also for much, much lower percentage, as you mentioned, much, much lower presence. Last time we talked to the Water District, back when we had the ARPA discussion, it wasn't clear that there were filtration systems that went down to that level. I presume that has changed, but that's something that I have in my list of questions for the Water District
One
also.
other point the website made is that there is this insatiable demand to meet these regs now, so the cost for all this equipment is sky high.
Yes.
And again, not saying any of this, isn't worthy and, shouldn't be done. I'm just saying it's not a problem most towns can solve. And I would argue almost any town could solve at the cost that's put in front of them. So.
And that raises the question that some people have about whether we should try to join the MWRA, which currently does not detect or detects such an infinitesimally small amount. That said, the connection to it is extremely expensive, or was last time. They costed it out. It's also, some towns connect to it only partially, meaning you still have to mitigate the water you have. So it becomes a question of how much you're saving by having that other connection. Some towns do that as backup also.
So from what I read in that you sent, and thank you for sending that, it's dealing with two systems, right, two different wells. But what about the other ones? I know the new well they drilled recently, the water's really pure coming out of there, which is great. And not knowing how much the filtration matter is going to end up costing, how much it's going to cost to run this is also a big wild card. That's going to be passed on to the rate holder, or to the user, I should say. And then you get into also, private wells, what happens with them? They're going to have PFAS probably in it too. So there's a lot of still unanswered questions with this. And I guess there's not a lot of, doesn't seem to be many systems out there that can handle this. So if you put this system in, does it also purify the water and get rid of other chemicals that are not PFAS? To make our drinking water even purer than what it is now with the PFAS. So I guess and will that have to be rolled out to the other wells too? So it's kind of very fluid, and I hope there's going to be federal government money to deal with this. It did come out that 75% of our nation's drinking water has PFAS in it, and that's massive. So we're not the only community in the state or the country dealing with something like this. So we just happen to be maybe getting ahead of it than some other towns, as Dave has kind of pointed out. And as you said, bringing in MWRA, yeah, sure. The connection is super expensive. It might, and from what I can see, it's cheaper to do the PFAS mitigation on our end than bringing in MWRA.
Jason.
I don't expect that anyone on this committee can answer this question, but it's just definitely a question I have. Definitely not being an environmental engineer in any way, shape, or form, but how can the MWRA, which is not that far geographically from us, how can they have a completely different set of PFAS than we do?
They have an extremely isolated water supply. The Quabbin Reservoir is very well protected environmentally, and it has stopped it. Because of what's been around it, the stuff just hasn't been able to leach into there. We have a shallow water supply in a lot of brooks that go through a number of facilities that for various reasons have used PFAS. It's not surprising if you look at the industries we've had around here that this issue has occurred. I mean, look, similarly on Cape Cod, there have been big issues with the Otis Air Force Base because of all the various testing they did of materials and fire extinguisher with the National Guard.
Fire retardant stuff.
Okay.
So there are areas that are much more likely to have it. We're not super likely, but it's not surprising. It's enough they haven't localized where it's coming from for us, but it's there. Because of the size of the area around the Quabbin they have been able to protect it.
So
And there hasn't been a natural source.
realistically, is there a possibility of if we just find a better place to drill our well, we'll be that much better off?
Potentially, I mean, they have some wells that aren't having the problem, but the EPA has also lowered the level so much. But you get it gets into the water from when you do your laundry, some clothing and other stuff have it. I think there's going to be a point at which it is absolutely everywhere, and any water supply is going to need filtration. That's part of my concern with going into the MWR is for them, it's not
It still rains
it's a
there.
question of
yeah.
when. Anyone down here, Christine?
I think we should talk about whether or not we have any plans to join fellow Massachusetts towns in some of the legal escalations that they're looking into. So like the town of Wayland and Hudson, Chelmsford, Burlington, Canton have joined class action lawsuits against some of the companies that are responsible for putting the PFAS into the environment. And it's clear that we're going to need a lot more help in solving this issue. As Dave said, there are a lot of communities that can't possibly afford to solve this issue. Anyway, I just wonder if we should ask about if there are plans to get involved in that.
Thank you. Who would like to join me on either October 23rd or November 6th? It is a Zoom meeting. And as I said, we're only expected to be there for the first 15 minutes. And I'm sorry, I don't remember what time the meeting starts. It's in the evening, I believe.
You can join.
Thank you. Do you have a preference for the 23rd or the 6th?
I think it's mildly more likely that I will be home on the 23rd, but if it's a Zoom meeting, that doesn't really matter. I can make it either time.
Okay. Anyone else? All right, thank you. I will coordinate with Jason around the exact date. We end up going with it. Thank you, everyone, for that. And if you think of any other questions beforehand, please pass them off to me. Hopefully, this is our last discussion of the point of view.
Well, I have some good news and bad news on that. With apologies to the committee, I do not have an update for the point of view for this meeting, which means we will go home sooner, but it does mean that you're just going to have to wait one more meeting, and then I will bring you the final product.
Well, thank you for all of your work, and no worries about this one. Next item is minutes. We've approved all minutes that are outstanding at this point, so we're up to liaison reports. Okay, Jason.
So, as everyone knows, the Boardwalk campus building is come a long way and is finally, it's been occupied for over a year. We're coming down to the last couple of months of this thing. We're actually hoping, don't hold anybody to this, but we're hoping to be done with the project in December, or done with Scansic in December. We're still going to have one outstanding power, net 000 power-related issue, which is outside of the official responsibility of Skanska for the building. So now it's time to talk about the true-up of the money. So if we go back in time, we took out a large bond because we were very happy with the interest rates at the time. We wanted to retire as much as possible, but we also knew we were kind of throwing a dart at the wall because we didn't know exactly what the MSBA reimbursement was going to be. We were hoping, we knew what the maximum cost of the project was going to be because we were doing that style of building. But we also didn't want to, and we definitely didn't want to overshoot, because if you overshoot, then you can be subject to ill-gotten gains for receiving revenue interest on things that you shouldn't have been borrowing for to begin with. So we took a fairly conservative approach. We worked with the time Dave Erdlino and his group. Our counterpart from Boxborough FinCom was a part of this as well. And we took out the first big bond of $70 million, give or take. In July of this last year, we paid attention to the fact that our cash flow wasn't perfect. There's some amount of time when we're waiting for the MSBA to reimburse. The project was, we were hopeful we'd come in under budget, but we didn't come in $5 million under budget. So we took out a one-year ban just to make absolutely sure we had no cash flow problems. Of that $5 million ban, we have not even earmarked a little over $1 million of it. We do have a little over $2 million encumbered in expenses, and that is a worst-case scenario. These are POs that have been opened, but if they come in under expectation, then these POs are not to exceed. If they come in under the expected amount, then that encumbered number will come down. And this big yellow box here, which is by far the most important thing, is the final MSBA reimbursement. As you see, they hold a 5% retainage. These are arrows at a dartboard, so we're gonna do our best here. But we're hoping for approximately $1.5 million in remaining MSBA reimbursement. We're hoping for some amount of money out of the unencumbered. In fact, I hesitate to put any number on it all because I could just get myself in trouble. But in theory, there's some significant amount of money in there. Obviously, it's a $2 million number, so don't think there's too much. And then, as I said, we've already not allocated the $1 million. So we're going to have to roll over this ban in July, no matter what. And by the time July rolls around, the yellow box and the expense encumbered box should be, pretty much all over but the shouting, especially if we get this thing finished in December. By the time July rolls around, these should be known knowns. That means right now, we're at just shy of $4 million that has been authorized. It's not like we have to go back and do this again or anything like that. But there's $4 million that we have on short-term borrowing that we're gonna have to refresh come July. That number will realistically go down to, hopefully, $2.5 million. Absolute best case scenario, $1.5 million. We think worst case scenario, $3 million. But so there's some fluctuation here. But what I want to bring to everyone's attention is we're going to go back in July and either take out a 5-year or a 10-year longer-term bond for this remaining $1.5 to $3 million. And that will go directly, that is not part of an operating expense. That is already excluded debt and will come to the taxpayer as an increase over the original $70 million excluded debt charge. So when we make that chart for capital expense, we got to put in a $1.5 to $3 million placeholder for this 5 to 10 year plan. Sorry, Christine, I know you wanted to be done with that slide.
So you're saying I did the right thing by not having
There you go.
us ready for, got it.
There you go. So again, this is, we don't need to go and vote again. This has already been authorized. This was part of the original authorization vote. I'm happy we're within shouting distance. I'm happy that this is we're not going to spend the entire money. This is generally speaking all of the good, but just don't be surprised. Don't feel kicked when there's a $1.5 to $3 million in added excluded debt that comes in, not for next fiscal year.
And you said that'll be like 5 or 10 years?
Either 5 or 10, we have not made up our mind yet. We're not going to make up our mind until closer to July.
Okay.
Questions?
Is that going to be at a different interest rate?
Absolutely.
So much higher
Well,
than the original bond, right?
so my memory on this is that it's 2.15, but we're going to get the exact number and plugged in. So, and then, so we did 2.15 for the first 70 million. We got 3.69 for the 5 million 1-year ban. I would expect us to be in the 4 range. I defer to our resident bond expert if he thinks I'm crazy on that one, but I'm thinking it's probably going to be in the 4% range for a 5 to 10 year.
Do you know what the blended rate is on the total borrowing?
No. It's only been two tranches, and the second tranche is a one-year ban.
Oh, so how did you get to 75? I just don't recall.
The premium,
Because you are,
there was a, here, let me. So
Oh,
we
okay.
took out 70 million, and we
Oh.
received a bond premium of 6 million.
oh,
So
70.
we don't actually pay back that 6 million, because it was a premium.
Maybe you said it, is it 2.15%? Is that what the excess is?
2.15 is what I believe the
Oh,
blended
okay,
was
yeah.
for the big one.
It's amazing, it's like 70 million at 2.15%.
We're pretty happy with that one.
I mean, some context would be is if we borrow like 50 million for the new DPW building, that would be probably the high 4s or 5%. So the actual cost would be much greater than the new twin school.
I agree with you. Thank you. Thank you for being the straight man on that topic. I swear we didn't convince in advance. Any other questions on this? This hopefully is just a formality. I just didn't want it to go under the radar, and so I wanted to make sure to bring it in as early in the conversation as possible. Yes, Christine?
Not really on this, but any sense on a resolution on the battery issue?
No. Actually, I can say that we did spend $6,000 for a safety consultant, safety subject matter expert consultant, and that report came back positive. Since then, there has been a non-safety related concern that's been raised. I don't know when we're going to be able to finalize this and get our next AMP position in place and fully make this building truly triple net zero. But please know that as many people as possible are rowing in that direction.
When you say it came back positive, you mean like to our benefit? Not,
There is not a safety concern.
okay, thanks.
All right, any others? No, okay. October 2nd, Select Board meeting was interesting, and I don't think at this point there's anything of particular financial impact for us to discuss. I will let you know at the next one. Do we currently have a liaison to the Acton Water District? It's looking like maybe we should have someone who specifically pays attention to that. Does anyone have any specific interest?
When do they meet?
But
That's a
do
great
we have
question.
influence into their budget setting? They have their own finance committee, et cetera.
They have their own finance committee, they have their own town meetings at which things are discussed. I'm not sure about the attendance of those, so there's a good chance that if we as a group went, we could significantly sway.
They meet on Monday nights.
From what I found out at their annual meeting, it's very thinly attended, maybe 25, 30 people,
Yeah.
something like that. So when you look at the town of Acton at 21,000 residents, 30 attend the meeting. We take up a large chunk.
Yes. Let me know if you're interested in covering the water district meetings. I don't know if they are recorded. Vlad, do you want that? Wonderful. They are on Zoom. I don't know if they're recorded, so you might need to attend them in person, online. As opposed to, like with the select board and the school committee, you can watch recordings. So you could email them and ask about that. Thank you very much. Our next meeting date,
Christy, did you get a chance to meet with Pam or not?
no, I did not.
Okay.
Minuteman has some resolution on their superintendent. She has left, but I have not had a chance to speak with our school committee rep to get any more details on that. Our next meeting is scheduled for Tuesday, October 24th. Please let me know if you cannot make that. Otherwise, we will discuss hopefully finalizing the point of view then. If you have any specific information or speakers you'd like me to bring in, please let me know. And let me know about that in general so we can get everyone in here who can help us do our job. Apart from that, I think we want to hear from Vlad.
I move to adjourn.
Do we have a second? Wonderful. All in favor, say aye.
Aye.
Opposed? Abstentions? All right, thank you, everyone. Good night.